Well, good afternoon. Weeks ago, we did the unthinkable. Faced with an extreme threat, a killer virus that spread around the world like wildfire. Faced with this deadly threat, we made the deliberate decision to wind down our economy and close things down. We decided that the health and safety of Ontario was what mattered most above all else. We took decisive action based on the best scientific and medical advice available to us. And our efforts so far have paid off. Working together, we're flattening the curve. At the most critical time, we ensured that our health system was not overwhelmed. Today, our experts are telling us that we're in the peak. How long this peak lasts remains to be seen. But now, thanks to all of you, thanks to the heroic efforts of our frontline workers, we're now in the position to start working towards reopening. We're in the position to set the conditions for reopening, and based on the best advice available to us, working closely with our health experts, our government has developed a framework for reopening Ontario's economy. This framework is a roadmap. It will guide our collective decision-making. It lays out the threshold we need to hit, the targets we need to work towards. Number 1, virus spread and containment. Number 2, health system capacity. Number 3, public health system capacity. And number 4, incident tracking capacity. The framework is about how we're reopening, not when we're reopening. And let me be crystal clear. As long as this virus remains a threat to Ontario, we will continue to take every precaution necessary. We will continue to act based on the best advice available to us. No one wants the economy to open up more than I do, but we can't take anything for granted. We can't take unnecessary risks, because we've seen around the world that all it takes is one person. If precautions are not taken, one person infected with this virus can spread it to hundreds of others. My friends, our future is in our hands. Because through our actions, by taking the advice seriously, by doing our part, we will determine when things open up again. The steps we are taking are working. But progress doesn't mean we can quit now. And that's why I won't set hard dates until we're ready, because the virus travels at its own speed. We must ensure our plans for reopening the economy reflect Ontario's unique situation. They must be responsible, they must be measured, and they must be guided by our Chief Medical Officer of Health, our command table, and our health experts. And I know how hard it has been for people. I hear and see the struggles every single day. Children walking by the playground, hoping they can play on the swings. Many sons and daughters seeing a loved one only through a window. Mothers and fathers dreaming of embracing their children for the first time in months. Grandparents aching to hold their first newborn grandchild. We're all missing birthdays, religious celebrations, and once-in-a-lifetime milestones. These are all too real, a painful loss of memories and moments taken away by this deadly virus. But that is why we must continue. It is why we are staying on the path of solidarity as a province, slowly, methodically, and gradually opening the economy. So this is the only time people will miss these moments. Together, we will create a lifetime of joy and special moments, time spent with family and loved ones, memories and moments that will never go away. Thank you, and God bless the people of Ontario. Now I'll pass it over to Minister Elliott.
Thank you, Premier, and good afternoon. because of the collective efforts of all 14.5 million Ontarians to stay at home and stop the spread of COVID-19, we have dramatically reduced the number of cases in the province. Most importantly, together, we have saved lives. It is because of the determination and resolve of the people of Ontario that we're now able to consider moving into the next phase of our battle against this virus. But as we do, we must remember that the threat of COVID-19 is not over yet. The Chief Medical Officer of Health has outlined the criteria by which we will begin to slowly and safely ease public health measures and restart our economy. Fewer daily cases of COVID-19, ongoing health system capacity, ensuring public health units can contact new cases within the day, and continuing to expand testing to ensure effective surveillance. There is light at the end of this tunnel. We have a clear path forward to safely and gradually ease restrictions. But to meet these criteria and begin to move forward, we need everyone to continue their extraordinary efforts to stay home. Your determination and resolve have been nothing short of remarkable. But together we will defeat this virus. Thank you.
Good afternoon, and thank you, Minister Elliott, for those comments. Under the leadership of Premier Ford and Minister Elliott, we have made incredible progress, and we are all eager to reopen the province. But I know from speaking to my constituents in Ajax and people across the province that we're also cautious. We don't want our hard work and sacrifice to be for nothing. That's exactly why we'll take a gradual, staged approach to reopening the province. We are releasing this framework today because while you're doing your part, whether that's working on the front lines or staying home to keep each other safe, our government is doing ours by charting the course for what comes next. The reopening phase of our plan will happen in 3 stages. We aren't going to reopen everything at once. Instead, we're listening carefully to the advice of our health professionals and opening in a way that's responsible, assessing progress for 2 to 4 week periods before going further. In each stage, there will be a natural progression in how workplaces, services, and public spaces can operate. Those that are lower risk or can immediately meet public health guidance will open first. And as we continue to get the outbreak under control, we'll continue to ease the restrictions. We'll also provide very clear public health guidance so that you can keep yourselves, your families, your neighbors, your employees, and your customers safe and healthy. Our colleague, Minister McNaughton, Minister of Labour, in partnership with Ontario's safety and health associations, business and labour leaders, and based on input from public health officials, will provide guidelines to employers on how to open safely and protect their employees and their customers. Documents will be made available across many sectors, as well as training to provide guidance to workplaces entering the restart phase. We've also added more workplace inspectors and specialists to ensure workers continue to be protected on the job during the pandemic, including adding close to 60 new frontline officials to support employers and workers in the field. And the capacity of Ontario's Health and Safety Call Centre has been doubled. Just as people's actions are why we are not experiencing the worst-case scenario, it's the choices we make as individuals and employers that will shape the outcome of the reopening phase. We must continue to be patient, diligent, and responsible by following public health advice and looking out for each other. The Ontario spirit has gotten us this far, and it will continue to serve us well. Thank you, and now I'll turn it over to the Vice Chair of Ontario's Jobs and Recovery Committee, Minister Vic Fedeli. Minister.
Thank you and good afternoon. Despite the rapidly shifting landscape, one thing has remained the same: Ontario's ability to come together in times of adversity, roll up our sleeves, and get to work to support each other. These extraordinary times have called for an extraordinary response, and we can all be proud about how Ontario's business community has answered this call to action. Since the launch of the Ontario Together portal, more than 18,000 submissions from businesses and individuals across Ontario have been received. More than 9,000 emergency supply leads have been converted into nearly $175 million in purchases of critical supplies and equipment to support staff on the front lines. We applaud all businesses, big and small, for taking action to support their fellow Ontarians, especially our essential businesses that make up such a key part of our economy. You have stayed open, and your employees have overcome incredible challenges to keep working. You've kept critical components of not just Ontario's supply chain, but in fact the entire country's supply chain moving. And many of you have shifted gears from your core lines of businesses and found ways to supply critical products to our frontline medical personnel to keep us safe. We recognize the immense toll the outbreak is taking on all business owners and workers. Our methodical approach will allow us to make sure we keep everyone safe as we get our economy going again. The same cooperation and leadership we saw in homes, communities, and in businesses that have helped flatten the curve will help us get our economy back into high gear. Importantly, the framework announced today by the Ontario Jobs and Recovery Committee includes an outreach strategy. The government and members of provincial parliament will consult with key sectors and all regions to assess the impact of COVID-19 and include their input in our plan to move forward. There is lots of work to do, but together we can ensure our economy will resurface stronger and more dynamic. We will continue to lead as the economic engine of our nation and as a province who bands together to take care of one another during times of need. Thank you.
We'll go to the phone line for questions. Just a reminder, it's one question, one follow-up. First question.
This question comes from Rob Ferguson from the Toronto Star. Please go ahead.
Hi, Rob.
Hello, everyone. I think this is best addressed to Minister Elliott. In the plan, it mentions for Minister Elliott. In the plan, it mentions that hospital cases will have to be going down, and we've had this increase in the last week or so. They've gone up from about 800 hospitalizations to almost 950. That's about 18%. Do you have an explanation as to why that's been happening, even though the numbers in intensive care and on ventilators have been relatively stable?
Well, we know that there have been some patients that have been moved from their residences in long-term care homes into hospitals because they need assistance. But the fact does remain that we have been able to expand our hospital capacity significantly in order to deal with COVID-19. Fortunately, we're not in the same situation as many other jurisdictions where there weren't enough hospital beds or ventilators to deal with the cases of COVID-19. We are fortunately in a place where we do have that capacity. We are able to continue to expand. We hope we don't need to because of COVID-19, but we are also developing a plan for bringing back elective surgeries, specifically cancer surgeries. We know that there is a big backlog of those cases outstanding. So once we get through this peak of COVID-19, then we will be able to get things back on track with the people that need those surgeries. And I would say that cancer surgeries have to be at the top of the list.
Okay, as a quick follow-up, in the document it also mentions about having to have more testing and contact tracing in new ways. So I'm looking for some specifics on that because we're still not even testing 13,000 samples a day.
Well, we are at about 12,500 day to day. We are aiming for 14,000. That will allow us to continue to do the testing that we need to do, both in terms of long-term care homes, retirement homes, and other congregate care spaces. But we'll also be able to do more in the community on surveillance testing to make sure that there aren't any areas that, that might break out. We need to be able to do that and make sure that we have the public health capacity to follow up on contact tracing within a day. So there still is more work to do in terms of keeping the number of cases down. We're starting to see a slight downward trend over the last 3 days, but we don't know whether that's actually a trend or just a coincidence. So we will be following that very closely. So there are those 4 criteria that need to work together to allow us to then be able to start opening up the economy more.
Next question.
Next question comes from Colin DeMello from CTV News. Please go ahead.
Hi, to the Premier. Your document says that you need a consistent 2 to 4 week decrease in the number of daily new cases. Do we believe that we are in that period now, whether we're at the beginning or the middle of it? Do we believe that we're in that period right now?
I guess if we're talking about the framework and when we're going to reopen, Colin, and as I always said, this is a roadmap. It's not a calendar. It's a roadmap. So we're going to continue working hard, and I just encourage everyone, please continue following the protocols. We've come so far with this fight, and we just don't want to give up now. We want to continue moving forward, and the quicker we see the numbers come down, the quicker we can get things back to normal. But right now, we have to keep following the protocol.
Thank you, Premier. And your framework doesn't really have a lot of details in terms of the types of businesses that can return. So, for example, in stage 1, it simply says opening select workplaces that can immediately meet or modify operations to meet the public health guidelines. Can you give us an example of what types of businesses would be allowed to reopen in the first stage of your roadmap? And will those employees be required to wear PPE like masks and face shields?
Well, I understand, and before I pass it over to the Minister of Economic Development, I fully understand people are itching to get back to work. I hear it. I talk to these people. And Colin, there's no one wants to open up the economy more than I do. I know we're seeing some challenges with the economy right now, but I'm totally confident. We had the economy on fire before, and I'm confident we're going to do it again. We're going to light a fire underneath the economy, but I'll pass it over to Minister Fedeli.
Thank you very much, Colin. As you saw, this will be opened in stages, and as the Premier and Minister Phillips and Minister Elliott said, this is a roadmap. This is not a calendar, and there are no specific businesses going to be outlined today. This will be done on an as required basis and taking our guidance on a daily basis from the health officials. Thank you.
Next question.
Next question comes from Sean Jeffords from the Canadian Press. Please go ahead.
Premier, I know that you've taken great pains today to talk about the fact that this is a roadmap, it is not a calendar. I think a lot of people are going to look at this document today and be disappointed it's not a calendar and that it doesn't have specific timelines here. What would you say to people who, frankly, were hoping for something more concrete?
Well, this is a conversation that we're just starting right now, and again, as mentioned to Colin, I want the economy to get going. Believe me, I want it to get going, and I understand the pain a lot of companies and people are going through and the pressure, and it hits home. I'll tell you, I talked to someone on yesterday, actually on Sunday, and they asked me the same thing. When's the economy going? And you talk about pressure. This gentleman called up and said, my wife lost her job. I'm temporarily laid off. I have 3 kids, and even with the payments from the federal government, how do we survive? You know, that hits home with you. And I'm a business person. I understand the pain he's going through. But my response was just hang in there. We will get to that point. And as painful as it is, what we don't want to do is be premature and open the economy up too early, and then this comes back and we see an escalation in cases. We're just so, you know, we've done such great work, everyone in Ontario. So I hear you, but this is a conversation, and this conversation will get better as we see the needle move and we see the flattening of the curve more. And I have to thank everyone in Ontario, the 14.5 million people. The reason we're here where we're at this point of the flattening of the curve is because of each and every one of you listening and working side by side and being collaborative with all the protocols that have come from the Chief Medical Officer. We'll get there, and we'll be rolling that out as soon as we see the consistency of the numbers dropping, and we're getting there. We're doing a great job, everyone.
And Premier, by way of follow, I'm wondering if you can talk a little bit specifically about the guidelines that are going to be in place for businesses as the later stages of this continue. You know, what are the conditions under which employees are going to be called back to work? Will there be limits on the number of people who will be in workplaces? Can you tell us what those will look like?
Well, what I'll do is I'll send this over to the Minister of Finance.
Thank you. Of course, driven by the best health advice and the work that's being done at the Ministry of Labour, what we've committed to is to provide clear guidance for workplaces so that and this guidance will come as soon as it's available, so that employers can start to make the plans that they need to make so that they can prepare for being able to reopen. This isn't just important for workplaces, it's also important for their customers. Obviously, we need to create an environment in Ontario where people can feel comfortable and safe in many environments where customers are a part of the workplace. So Minister McNaughton has been working very closely with our public health officials, and that guidance will be very clear. There'll also be, as I mentioned, training and support on that so that workplaces can understand what's required in their specific workplace and have it in place on a timely basis.
Next question.
Next question comes from Cynthia Mulligan from City TV. Please go ahead.
Hi, Premier.
Hi, Cynthia.
It does feel a little short on details, and to Sean's point, I think that many people will be a little disappointed because they're itching for more information.
Yeah.
There's no mention of schools, and I'm also wondering if you're under increased pressure when you look at countries like Italy that was so hard hit, and yet it's easing restrictions starting May 4th.
Oh, we aren't going to be rushed into anything. The health and well-being of the province is the #1 priority, and making sure we follow the guidelines of the Chief Medical Officer and the health table. I know Minister Lecce announced that the schools will be closed by until May the 31st, and we'll be reviewing that as we get closer to that date. But again, I just don't want to go out there and start setting dates and we see a spike, and then all of a sudden we have to slow things down. Let's just get it right the first time, and then we'll be able to have a better idea. But hopefully, if we can see the numbers come down over the next couple of weeks, we'll be able to roll out or lighten up the measures from the Chief Medical Officer. But going back to the 4 guidelines I said earlier on.
My next question, thank you. My next question is about restaurants, and I know you don't want to get into specific businesses, but I'm wondering if there's any discussion around restaurants and perhaps allowing those with larger patios to open sooner and not have them as crowded.
Yeah, that's a very good question. There's thousands and thousands of restaurant owners out there that are really struggling. But what I'd like to do is pass this over to Minister Fedeli, and he's the one, along with the Minister of Finance, that are working on this.
Thank you very much, Cynthia. So you are going to see this come out in a staged program, and we're going to continue to consult, as I said in my remarks, with all of our sectors. All of the MPPs are going to be consulting with each and every sector within their own community and right across Ontario. We're going to take their advice. We're going to take their ideas, their best practices that they can propose, take them in and present those to the health table. But these decisions are primarily geared on a health information. Thank you.
Next question.
Next question comes from Laura Stone from the Globe and Mail. Please go ahead.
Hi, Premier.
Hi, Laura.
I'm struck in the document to the reference about this being the new normal. So, what do you think this means for Ontario for the next few months, but even for this year? Is this, the way we're living now, going to be the quote-unquote new normal for Ontario in 2020?
Well, we're going to have to see. I think life and business is going to change overall based on technology and other areas, and you know, we're doing things differently, and there's an opportunity to change things for the better. But the quicker these numbers come down, Laura, the quicker we can go back to the semi-norm, as we say, and if we can continue working as hard as everyone has been working, then these numbers will come down, and then we'll get back to as normal as possible, and until we get a vaccine for this virus, and it's a little ways off. I don't think it's going to be 100% normal. It won't go. I don't think it will ever go back to where it was before because our lives have changed, and we're doing things differently, and we're just going to have to keep moving forward. And again, the quicker we can get this flattening of the curve to go south, then we can get back to semi-normal.
And just to follow up, in the document as well, the reference, even in phase 3 or stage 3 of the restart phase, saying no concerts or sporting events for the foreseeable future. Yeah. So in your estimation, are we going to have a summer without concerts, without sports games that we can attend at the very least? Is that what you're seeing now? Is that what you're predicting for at least the summer here?
Well, Laura, I wish I could have a crystal ball and see where we're going to be in August, and I'm just praying that it's going to go the right way until we can, you know, possibly do that. But I just don't want to say right now, and I don't want to commit. No one loves sports more than I do, and everyone loves a good concert. But again, we're working with these areas, and I know our minister, Minister McLeod's working hard, especially in that arena. Working and talking to the people that promote the concerts, working with the sports franchisees, and we're going to see what happens. But I don't believe when sports come back, they're going to come back with a full stadium anywhere in North America. I think there'll be empty stadiums at the beginning.
Next question.
Next question comes from Lisa Shing from CBC. Please go ahead.
Hi there, Premier.
Hi.
Are there any parts of the province you're not going to consider opening until there is a vaccine?
Oh, we can't say that. I think we've always been down the line of, you know, we have to open up together, because it just takes one person from a heavily hit area, be it Toronto or other regions, to go up to maybe a rural area, maybe go up to cottage country, and it just starts spreading. So we'd like to do this all together and slowly, methodically open up the economy.
Thank you. And I think my next question is probably best suited for the health minister.
Yep.
One of the criteria you've stated is that public health units should be able to trace 90% of new case contacts in a single day. What exactly is it going to take for that to happen? How are we going to get to that 90%?
We're continuing to build on that daily. I have heard anecdotally that they are quite prompt in their response, but we need to make sure it is within that 24-hour period, because it's so vital in order to contain any spread, to make sure that people are notified, that they're contacted, to make sure that they, first of all, if they are under self-isolation, to make sure that they have the supplies that they need, and to confirm that they have been in self-isolation, because that's the only way that we're going to be able to control the spread when people are in that situation. So we need to have all of those 4 pieces working together before we can say that we've gone through the peak, that it has plateaued and the numbers are starting to come down. So we can't look at any one piece separately. They all have to come together, and that will be how the Chief Medical Officer of Health is going to make decisions going forward.
Next question.
Next question comes from Travis Danrash from Global News. Please go ahead.
Hi, Travis.
Travis? Okay, we'll go to the next question.
Next question comes from Brian Lilly from the Toronto Sun. Please go ahead.
Premier, you've said that it's due to the work of the 14.5 million people in Ontario following the rules that we've been able to get this far.
Yeah.
and you need us to keep following those rules. As the weather gets better, that will become more difficult. So I'd like to hear your thoughts on that. And also, how do you actually, does there need to be some common sense from officials that are enforcing the rules? I can point to the officials in Ottawa last week chastising people for having a beer with their neighbor across their driveway, or the police in Elmer that are threatening to ticket or charge people that held a drive-in church service where everyone's windows were up. Does there need to be common sense on the side of officials trying to have us all follow the rules in order for us to keep buying in?
Yeah, well, I appreciate that question, Brian. I think in life in general, you have to use common sense, but I have all the confidence in the world in our police. That would fall under their jurisdiction. If they, they see a neighbor having a beer with someone, again, that's going to be up to the police. That's not going to be up to us. And I have all the confidence they're going to use good judgment on that, and and talk to the people. But again, I can't comment for the police. I don't direct the police. That's going to be up to them. But I think in life in general, common sense is a good thing.
Are you concerned about the fact that it is getting so nice outside that people will start going to the cottage more? You've talked about not going to the cottage more, but again, one person going up north can spread this. Are you concerned that people will just stop following the guidelines that are out there right now?
Well, I hope they won't, and I understand it's going to start getting warm, and and it's people are going to get a little antsy to get outside. I understand it. But if we can hang in there a little bit, when it rolls around August, if we see the numbers down, then you'll have more time to get outside. We just have to hang in there. All the work we've done can't go for nothing, Brian. We just got to keep working hard, and we'll get through this. And with the economy, not too many areas in North America can say this. I have so much confidence in the people of Ontario and in our team. We did it before, and I'm not going to get in the weeds, but we inherited a mess, 300,000 jobs lost. We ended up in 16 months create the environment for 307,000 jobs. With the team behind me and the rest of our team and the people and the ingenuity of these businesses, we're going to ramp it up like this province has never seen before. People will get back to work. We'll have the economy booming once again. That I am confident about. So we're going to get it done, and just bear with us and keep working like you have for the last couple months. We'll get through this.
Okay, we'll try Travis one more time, and this will be the last question.
Travis?
Last question is, go ahead.
My phone cut out. So I don't know if this question was asked or not. So stage one, we aren't at stage one yet. And these stages could take upwards of 4 weeks or so, and they could be rolled back if we see a surge in COVID cases. So are we realistically looking at the fall until the economy is open again?
Again, we can't answer that right now, Travis. We wish we had that crystal ball that would be able to see what's going to happen in the future. But I know one thing: if we all keep doing what we're doing, we're going to see great results. We saw positive results in the last modeling, and let's see how the new modeling, when that comes out, how that looks, and that will determine how we can move forward. We are being methodical when we look at reopening. We have no choice. But Travis, if we continue doing what we're doing, there's going to be positive results, and I appreciate everyone wanting to get outside and go back to the norm, but let's just keep doing what we're doing, and it won't be far off.
And if I could ask about revenue, how have provincial revenues been affected? How will they need to be affected? And what will this mean for tax increases?
Well, I better hand this over to the man that takes care of all the money down here, the great finance minister.
Thank you for that question, Travis. So when we made the decision to make the change from a full budget to a one-year plan, we also adjusted our revenue forecasts and our expectations. And we were unique in Ontario as far as governments in Canada to do that. And that was because we wanted to make sure that we made the adjustments we could. And as you'll remember from that last month, we built a record amount of prudence into those estimates. That said, this is a situation that's evolving, week to week in terms of impacts, and clearly we are not only dealing with the situation even here and in Canada, but across North America and internationally. So one of the things that this government is committed to is that we will provide regular updates on a quarterly basis. I believe the next one that is scheduled will be in August, so we'll provide a clear update at or before that time of any impacts when it comes to revenues and the finances of the province. But be assured that we have taken a very prudent approach. It's why we adjusted our timing, why we made the plans that we did, why we put so much prudence into our budget so that we can provide the vital services that Ontarians need at this time.
Okay, thank you. That's all the time we have for today.
Great. Thank you, everyone.